The most effective way of achieving total wellness when treating a substance use disorder is to understand that substance use disorders are a chronic disease. The industry has looked at substance use disorder as an acute disease for too long, and it is a chronic disease, and we have to have that kind of approach in order to make a difference in treating substance use disorder. Patients should look at Caron as the ideal treatment setting to get the medical treatment that they deserve because of our multidimensional and multiphasic approach. Caron puts a premium on having professionals on this campus who are very well educated with significant experience. Those professionals evaluate the patient early on, and that informs the treatment plan. We believe that this collaborative approach of a team trying to take care of patients here on this campus allows the patient the best chance of sustainable recovery.
Our team of psychologists, doctoral level, full-time psychologists work closely with the medical staff to address co-occurring disorders in our patients. And while we use medications to manage symptoms, we also rely heavily on psychotherapy and evidence-based treatments, which are provided by the psychology staff.
Evidence-based success cases and some examples exists ubiquitously through this campus.
Trauma plays a very important role in either the maintenance of addiction in an individual or the onset of addiction in an individual. At Caron, we see trauma as key to treating addiction successfully. We see a lot of people come to treatment with any number of traumatic experiences in their history. And what we know from the research is that not treating PTSD and trauma concurrently with addiction treatment leads to higher rates of relapse. At Caron, we chose to use cognitive processing therapy as our primary mode of treating symptoms of post-traumatic stress disorder. It's an evidence-based treatment considered a gold standard in treating PTSD. The research is strong on the effectiveness of cognitive processing therapy. We have 25 staff at Caron who are trained to provide this treatment, and so our patients who need it will get that treatment when they're here.
Neurofeedback is a clinical tool that we offer. It's a clinical tool that is different from most modalities of treatment because it directly addresses brain function. What we do is we take a look at how the brain is functioning, and in real time we can feed that back to patients almost like a mental mirror. During a neurofeedback session, a patient will be sitting in a chair and we'll be monitoring their brain function with some kind of brain imaging technology, whether that's EEG, electroencephalography, or fMRI, functional magnetic resonance imaging. And one of the things that we do is we take a look at that brain function as it is in real time. So the risks to neurofeedback are minimal. This is a non-invasive therapy where patients are actually the ones making all the changes for themselves. So we're not stimulating them, we're not invading them in any way, we're not providing them with some kind of medications to change the way their brain is functioning independently of what they're doing.
We are seeing more older adults who are addicted to their prescription medications as well as their alcohol use. And certainly there is a concern around the country of a large and growing issues regarding substance use disorder in older adults. The older adults are defined as anyone age 65 or over. That's mostly the baby boomer generation, but also could include some older folks as well who are considered the silent generation. Treatment of older adult population for substance use disorder is unique because of the many underlying medical comorbidities that's involved in this population that may oftentimes mimic symptoms from substance use disorder and vice versa. And so taking care of this population, not only do we have to be cognizant of their substance use disorder and the presenting symptoms, but we have to be aware of their underlying medical conditions and be able to manage those conditions appropriately, because oftentimes they intertwine and affect each other.
Caron puts a premium on research. We feel very strongly that we need to come up with objective modalities in predicting relapse and evidence-based practices regarding the treatment of substance use disorders. So we have partnered with the National Institute on Drug Abuse, the NIAAA, and with Penn State College of Medicine and Hershey Medical Center in those endeavors. Some of the research that we are doing looks at identification of relapse. So far, we've done 2 pilot studies, each with 50 patients in each study. One study is looking just at opioid use disorder and the other study at alcohol use disorder. And in each of those projects, we were able to predict relapse weeks into treatment 85% of the time.
When I started working at Caron 9.5 years ago, I wasn't really familiar with Caron's reputation, but over the years, I've heard patients tell me that Caron is a place where people really care. And these are patients who've been to many other treatment centers in the past and who landed at Caron because none of the others worked for them. And walking on this campus, I know that the clinicians and staff here really do care about our patients' welfare, and I'm proud that our patients can feel that.